Hello and welcome to the Mind Over Matter Culminating Project presentation. This presentation is brought to you by Sacramento State University RN to BSN nursing students, Diana Yepes, Mario Ballesteros, Francis Gutierrez, and Guillermo Uberino Ulloa. The community of focus for our culminating project is Edison High School, which serves over 2,600 students in East Stockton, 98% of them belonging to minority ethnic groups. Per Monroe et al. 2023, this is important to recognize as minority ethnic adolescent groups are more likely to struggle with negatively influencing health outcomes secondary to their social determinants of health. Edison High School is one of 13 schools in Stockton Unified School District and is very well known for their spirited and diverse student population full of pride and inclusivity. Per US News 2022, Edison High School does struggle with maintaining graduation rates, addressing academic gaps, and lacks sufficient provision of resources for students, such as mental health resources.
With that being said, the goal of our program is to acknowledge and address mental health needs in adolescents. Mental health continues to worsen in the adolescent population. According to Healthy People 2023, there has been worsening or no detectable positive change in recent years regarding adolescents' mental health. According to the CDC, in the year 2021, 42% of students have felt persistent hopelessness, with nearly 1/3 of students experiencing poor mental health. In addition to that statistic, 22% of students have seriously considered attempting suicide, and 10% of students have actually attempted suicide. Now, why should we care about this issue? Well, the suicide rate is higher in San Joaquin County than in the state of California. According to the CDC, there is an average of 9.2 deaths per 100,000 adolescents in the county versus 8.7 deaths per 100,000 adolescents in California. Not only is our suicide rate higher, but we also have a lack of mental health providers in the county. Currently, we have 190 providers in the San Joaquin County per 100,000 residents, as opposed to the state of California with 289 providers per 100,000 residents.
For the CDC, suicide rates in San Joaquin County are higher than the California state average, which recognizes the adolescent mental health crisis as a community-based issue for San Joaquin County residents. There are various programs and partners in San Joaquin and in Stockton that could aid with the Mind Over Matter project in bettering the mental health of adolescents. These are programs and agencies in the community that share the common goal of providing a passionate mental health commitment for families and their loved ones, which look to provide intensive and comprehensive mental health services to help families keep their children and youth safe and healthy in school and out of trouble. Aid can come from the Stockton Unified School District Mental Health and Behavioral Health Services, the San Joaquin County Behavioral Health Services, the Access Mental Health Plan, and many more possible project partners.
Next, we're going to be talking about 3 different goals and interventions on 3 levels. The first level of being the individual or family or group level. The goal is by May 31st of 2027 that 75% of Edison High School students will demonstrate their ability to recognize mental health as a priority and will also be able to identify 3 mental health resources in the community. Some interventions that are going to be in place to reach this goal is to implement a mental health course that practices mindfulness and resilience. Mindfulness is shown to teach students to be aware of their feelings and emotions, which results in cultivating a range of positive and effective strategies to learn how to use when in need. One of these techniques is the application of the stop, observe the breath, step back, and watch the mind technique. Combining these techniques with the breathing and meditation techniques, it is shown to be cost-effective for students and teachers in the classrooms. Not only do these techniques help the students, but it helps the teachers and the family, and it also promotes better academic performance, better social environments, and better outcomes. Next, we'll be talking about goals and interventions at the community and agency level. For Mind Over Matter program, by May 31st of 2027, The Edison High School community of Stockton will host 2 mental health fairs per year that raise mental health awareness and provide education about resources that are available, such as counseling services, support groups, and crisis hotlines. One of the interventions this program has is to promote the health fair throughout the community via social media posts through Facebook or Instagram, local advertising in local shops and grocery stores, flyers posted on bulletin boards, and morning school announcements. By collaborating with local resource communities, restaurants, and businesses, chances of promotion for the health fair and attendance during the health fair can increase. They can participate by hosting their own booth or even provide discounts for attendees on the day of the fair. By doing so, this will promote positive health-seeking behavior and betterment among the community, especially the students.
Moving on to policy and/or legislative, the goal for our program would be by May 31st, 2027, 75% of all high schools in California will implement a mental health-based app through their mobile phone or through school's web-based platform for students to have access to mental health resources. The interventions would be implementing a Senate bill in regards to having the mental health app and web extensions within high school web platforms like Canvas and have students to access it 24/7. According to Placia 2023, study on teen mental health apps shows high engagement and a positive impact. Approximately 91% of the students engage with their app due to the easy access of the program, and about 3 out of 4 students engaged in the interactive activities the app had available. With the interactive activities, includes helping with coping skills and mechanisms, and it offers even live coaching. In addition, about 83% of the users reported improved hope, 84% reported increased self-esteem, and another 84% reported the live coaching was helpful and useful for dealing with stress. In summary, the Mind Over Matter program emphasizes that mental health in adolescents and high school can be affected by various factors. Social determinants of health can include the lack of resources due to educational disparities, lack of access to mental health resources due to transportation, distance, and even adverse childhood events. Other SDH include sexual orientation, English as a second language, and students with disabilities. The lack of resources in Edison High School and mental health providers are significant to the mental health of the community. So with the biannual mental health fairs, Mind Over Matter mental health app and mental health course are proven interventions that can be a benefit for the mental health of adolescents at Edison High School. Local community resources can be greatly recognized and utilized with the implementation of our Mind Over Matter mental health interventions. Mind Over Matter aspires to achieve better engagement with students in regards to mental health topics and even an increase in utilization of mental health services. Mind Over Matter hopes to provide students more tools and resources they need to achieve a better outlook in life.